American Heart is set in a Minnesota clinic that specializes in healthcare for refugees and shows the specific challenges that doctors face in caring for these new immigrants. With me today to discuss how these challenges play out across the country is Dr. David Gunther, who works at a different clinic serving immigrants, the Boston Center for Refugee Health and Human Rights at Boston Medical Center. Thank you for joining us.
Thank you.
Dr. Gunther, what has it been like for you working with these patients?
I recognize on the one hand that their trauma histories are inevitably histories that are difficult to hear and could cause sort of pain and discomfort to anyone hearing them. On the other hand, what comes through and what persists in my mind is really not so much the trauma history as the story of their perseverance and resilience. That they were able to come here at all, and that they were able to persevere in life in the U.S. It can't help but be inspiring.
Incredibly inspiring. And the healthcare system is difficult enough to navigate, and then on top of that, you're talking about people who are coming from very specific circumstances, and there's a lot of barriers there. In the film, one of the characters, Alex, who's Ethiopian American, talks about how difficult it is for some African immigrants to talk about depression because they see it as being crazy or madness. What do we know about treating patients from this region with mental health issues?
The majority of people do get better, which is not to say that they don't continue to have sometimes lifelong symptoms, whether it be of depression or PTSD. But one of the things I can say fairly reassuringly when I see people who have come recently is that things will get better. Some of that improvement is taking place partly because the conditions and uncertainties of their lives are less. It's also the effect of appropriate counseling, if necessary, appropriate medication. And maybe somebody doesn't want to go near the topic of depression per se, but they're willing to discuss anything and everything about how they might sleep better.
I just can't even imagine how complicated that would be when you're trying to convey information that is so sensitive about their health.
I think it's a difficult area for most people to talk about to some extent. People often see it as indicative of something else, something that they're not doing right, or perhaps some kind of maybe a spiritual struggle. There are certain commonalities between most of the people who I see, amongst them being major losses, and also traumatic experience. So for many people I see that can include torture. It could be, and often is, having family members, friends having been killed.
How does that then affect the way that you treat them?
One of the things I try to do is to normalize at least their responses, to reinforce the idea that what they're experiencing, what they're going through is utterly understandable and to some extent the norm. For people who have suffered the particular experience that they've suffered.
And what is their reaction to your telling them that?
It seems to be very reassuring. People come with all sorts of fears, amongst them being that they're going crazy, or that maybe they were injured in some ways, maybe brain injured, in the course of one or another, physical trauma. And oftentimes the most valuable thing one can do for somebody is to just reassure them, that whatever it is that they were afraid of just happens not to be the case. They see people who are worried that they have something wrong with their heart because they have chest pain, or something wrong with their brain. They have good reason to have those fears because they've been traumatized in those areas and they have ongoing symptoms in those areas. Luckily, in the majority of cases, it turns out that they're okay. They may or may not make clear the extent of their anxiety about these symptoms up front, and sensitivity to their level of concern is important. And then doing the right evaluation, which might include some tests, is ultimately, hopefully, helpful in alleviating those fears that they have.